Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. So the patient in this procedure attended with bilateral, fully occluding, soft, slippery earwax with a lot of dead keratin, so dead skin. And we're just starting off in the left ear here. And this outer layer of skin, it's lateral, so I'm just using the Zollner suction probe. And we know this is skin by the texture, the glossiness, the consistency, and it's a long tail of skin. And typically keratin, so dead skin in the ear, you have ribbons. And if you look very closely, you'll see this rippled effect on this layer of skin. There's a bit of earwax attached to it. Everyone has skin in the ear canal. You can see it a lot better now. So this skin, it's coating the plug of wax and it's adhered to the ear canal wall, and the patient has got quite a bendy ear canal. The second bend in particular is quite pronounced, and you can see the suction probe just got blocked there, so I was just wriggling it, trying to unblock it. So the skin of the ear canal, it coats the entire ear canal, including the outer layer of the eardrum. So the eardrum has got 3 layers. The most outer layer, which is most visible to us, the lateral layer, that's the same skin that lines the bony part of the ear canal. You can see a huge plug of wax coating with dead keratin. It's a bit of wax at the roof of the ear canal, so I'm just going to go back in, and this is why the endoscope's so much better in my opinion than other techniques. Just the view you get, it's just amazing. So just going back to the skin that lines the ear canal and the eardrum, so the outermost layer of the eardrum, it's the same skin that lines the inner 2/3 of the ear canal, the bony part. It's a very thin layer of skin, about 0.1 millimeters in terms of thickness. And the ear's evolved over millennia. It's very intelligent actually. So imagine you've got some dead skin on your hand or your arm or your shoulder or your scalp even. When that skin dies and sheds, it just falls onto the floor. But with your ear, if the skin just shedded and dropped into your ear, everyone's ear canals would be full of dead skin and they wouldn't be able to hear. And I'll be even busier than I am at the moment removing that. So the ear has uniquely developed a mechanism to self-cleanse and allow this dead skin that sheds to migrate out of the ear. You can think about it almost like a snake skin. So the skin that it starts shedding from the center of the eardrum and it migrates outwards. So if I were to put a pen mark on someone's eardrum, which I won't, but it has been done in studies over the weeks and months, that pen mark will move sideways out of the ear canal, and so this skin sheds on a similar rate as how your fingernails grow. So you're probably looking around, I think it's 3.5 millimeters per month on average. You get people that differ. I'll come back to that in a moment. So again, this is the right ear. You've got a huge plug of wax, dead skin out. You've got this keratin there. You can see it just at the entrance here, and it's half out. It's half adhered to the canal wall, and it's half not. It's very stubborn though, and I'm going to use some forceps in a moment to help just remove this, but it doesn't want to come away. Sometimes with dead skin, instead of peeling forward from the entrance of the ear canal towards the eardrum, if you come the other way, almost backwards, so if you kind of try and peel it from the eardrum outwards, it sometimes works, and you'll see me in a moment trying to do that. So I'll just come back to the skin migration. So yeah, the skin starts shedding from the center of the eardrum, and it sheds sideways outwards, almost like a conveyor belt, on average about 3.5 millimeters a month, similar rate as your fingernail growth. And we call that epithelial migration. So the outermost layer of skin is the epidermis, and so hence why we call it the epithelial migration. And that sideways conveyor belt motion is very important because obviously it allows the skin to naturally migrate out of the ear so it doesn't collect and block your ear canal. But that migration, that conveyor belt, also helps to allow earwax that's typically secreted on the outer third of the ear canal to also come out. So it has got 2 functions. This migration of epithelial skin cells that lines the ear canal, it allows the skin to come out of the ear, but it also helps transport any wax that's secreted in the outer third. So, but obviously that doesn't work for everyone, and not everyone has the epithelial migration. It doesn't work for everyone. And there's several reasons for that. As we get older, the skin, the epidermis layer, it's not as good as retaining moisture fluid, so the skin gets drier, so it doesn't migrate as much. You get more friction. Some cases, from what I read in the literature, is that people who've undergone radiotherapy, they lose the ability for this skin layer to shed and migrate. So if you've got a very twisty, narrow ear canal with loads of bends, that skin doesn't migrate outwards as well. Also, if you've got a mastoid cavity or any abnormal craters or divots or trenches in the ear canal, that skin can get trapped within that crater, which can lead to other problems. So there's many reasons. So just going back to the procedure, I've just got a fine end, just trying to suction some of this wet wax and dead skin off the eardrum in the anterior recess. So I was kind of partly hoping I suction this and it comes off the eardrum and I can work backwards and peel this remaining skin, but it wasn't going to happen. So the skin was slightly clarinetting, I think, at this point. So one of the issues with dead skin, if you're trying to suction it, so I'm just trying to lift it laterally to see if I can get some purchase. It can clarinet, and clarinetting, and I think probably at this point it was clarinetting. So clarinetting is when the skin violently flaps at the tip of the suction probe, and it can emit a very loud high frequency squeal. So I've just left that, just gone back in with the forceps, just to kind of slice that last bit off. You can see that you can get blistering as well. Imagine you've got dead skin on your fingertips and you peel it, you do get a bit of blistering, but that's fine. There's that a plug of the wax dead skin, I think from the patient's left ear, the first ear. So you see it's coated with the dead keratin, is the plug of wax. I hope you enjoyed that video, guys, and you're all having a lovely Easter. Take care, bye.